Our group presentation was on vitiligo. I'm Vinny Borghese, Connor Lawyer, Jaden Hawkins, Io Gal is in my group. A little introduction. Vitiligo is a dermatological condition that manifests as a progressive loss of pigmentation in the skin, resulting in development of white patches across various areas of the body. This is a non-contagious disorder. It occurs when melanocytes, the cells responsible for producing the skin pigment melanin, are either destroyed or cease to function. These prices cause of vitiligo remains complex and multifactorial, involving a combination of genetic, autoimmune, and environmental factors. This condition affects individuals of all ethnic backgrounds and ages, challenging not only their physical appearance, but also impacting their physiological and emotional well being. While vitiligo itself is not physically harmful, the social stigma associated with altered skin pigmentation often underscores the importance of raising awareness and fostering understanding about the skin disorder. This is also called, oh, go ahead.
Yeah, so getting a little into the normal structure of the integumentary system, which was our assigned topic. First off, as Vincent mentioned, this results from the destruction of melanocytes, which are the cells responsible for the skin pigment. And it's not contagious or life-threatening, but like Vincent mentioned, it can significantly affect a person's quality of life. But getting into some of the normal structures, compromises the skin, hair, nails, and glands. Typically, the skin acts as a protective barrier against environmental elements and pathogens. And then for the hairs and nails, provide protection and enhance sensory input, and the glands are involved in producing sweat and oil to regulate the body temperature and moisturize the skin. So obviously, with this disease, those compromisations are an impact. Another normal function is it acts as a protective barrier against environmental hazards, and it's heavily involved in temperature regulation, sensation, and vitamin D synthesis. So as you can imagine, compromising things like this is very impactful because these are important functions of the body in general. So getting into signs and symptoms, I want to make a clear distinction between the two first. So a sign is objective and measurable indicator of a disease or condition that can be observed by a healthcare provider, whereas a symptom are more subjective experiences or feelings reported by the patient. So they can't be directly observed by others, and they're only based on patient's description of their experience. So you're getting into some of the signs. We have presence of white patches that are more common on sun-exposed areas, like the face, hands, and arms. As you can see in the image in the middle, premature whitening or graying of hair that can occur on the scalp, eyelashes, eyebrows, or beard. As you can see in that image, it's the graying of the eyelashes and a little bit of that presence of the white patch around the face. We also have a change in color of the retina and loss of color inside your mouth or your nose. So those are all a lot of the signs that you can see. As for symptoms, sunburn is you sunburn easily on affected patches. So in general, you're just more sensitive to sunlight. The patches can become itchy. Hearing loss may develop. And then another big part of vitiligo and the impact it has is emotional distress. So that could include low self-esteem or some anxiety due to changes in appearance. And the patches also might enlarge in size or increase in number over time. And there's also a connection to thyroid disease, which is more of a complication, which I'll get into a little bit on my next slide. But people who have vitiligo have a higher risk of developing some other autoimmune diseases like thyroid disease. So blood tests can be done to find these type of autoimmune diseases. So getting into some causes and complications, some of the causes, genetic factors, it can run in families, so it'd be hereditary. And then some of the others that are kind of connected to the signs and symptoms, like severe sunburn and injured skin. So any cuts, scrape, or burns you might have can, be more be areas that could be affected by this disease. And also some exposure to strong chemicals on the skin. One example is phenol, of a chemical that can affect this. For complications, like I touched on a little bit, it affects psychological well-being. This could be, like I said, self-conscious, anxious, depressed, angry, frustrated, embarrassed, any of those. Another one is increased risk of sunburns because you're more sensitive, and social stigmas that you may have to deal with in public or just in everyday life. Getting into the next point, oxidative stress and its connection to vitiligo. There was a study done to find any possible interconnections of oxidative stress in the immune system contributing to the melanocyte loss that causes the depigmentation of the skin. Oxidative stress is a psychological condition that arises when there's an imbalance between the production of reactive oxygen species and the ability of the body to neutralize them through any antioxidant defenses. So if there's an excess of the ROS, that can cause the stress. And the conclusion of the study was the interaction between the two, oxidative stress and immune system, initiates and or amplifies the mysterious loss of melanocytes that can't really be described by scientists yet. And the buildup of ROS combined with that immune system defects can cause an inappropriate autoimmune response, which can cause the disease that's in topic.
All right, now we're moving up to a risk factor in the population at risk. So a study that highlight later in the documentation, we found out that a study was conducted on 815 broadhands in South India, and this study underscored this hereditary aspect. This means individuals with a family history of vitiligo are also at a higher risk of getting it. Moreover, vitiligo is closely associated with the autoimmune disease, and the environmental triggers such as skin trauma, chemical exposure also play a pivotal role. While we cannot alter genetic predispositions, we can certainly manage the environmental factors like minimizing skin trauma and avoiding harassed chemicals. Now let's move our focus to prognosis of vitiligo. This condition is characterized by its highly individual nature. For some, it may present as small, stable patches, while others might experience extensive and progressive depigmentations. So this unpredictability is the hallmark of vitiligo's progression. Interestingly, spontaneous repigmentation can occur particularly on the face and trunk. However, those response to treatments varies widely among individuals. Some respond well to the therapies like UVB lights and to chronolysis, as highlighted in the study posted in 2021, published by Frontier in Immunology, while others see little improvements. The psychological impact of vitiligo cannot be overstated as well. This visible nature of the condition can lead to a significant emotional distress. Therefore, a holistic approach to the management, encompassing both medical treatments and psychological support, is very essential for the patients. And now we're moving on to the treatments.
Okay, so there are several different types of treatments for vitiligo. However, the overall biggest contradiction is that it cannot be cured. Therefore, treatment for vitiligo is a slow process, and one can regain their natural skin color a little over time, but the repigmentation can fade. So progress can be made, but the natural skin color can fade back again. So for the first treatment option we have is topical medications that can help restore the skin color. One of those is corticosteroids, and they're anti-inflammatory medicine that works best for people recently diagnosed with vitiligo. And some of the side effects can be thinning of the skin lesions, and acne. And then there's tacrolimus ointment or pimecrolimus cream, and they're both used to treat eczema patients by weakening the skin's immune system to decrease allergic reactions. However, these medications can also help restore skin color on the head or neck. And with these medications, some side effects can be burning and itching. Then there's calcipotriene with a corticosteroid, and these can help increase the amount of repigmentation. Then we have a JAK inhibitor, and that reduces inflammation, and it's used for people with non-sentimental vitiligo, which means that they have symmetrical patches. And then the second treatment option is light therapy, which can help restore lost skin color. So light therapy uses UV light to restore the natural skin color, and it's most effective on the face and neck. And for vitiligo, this light therapy is called phototherapy. And so a patient will stand in this light box, and this is where the UV light comes from. And so for a certain amount of time, and then the dermatologist will calculate that unique time for each patient. And to treat specific areas, dermatologists will use laser therapy on small areas, and this will reduce effects on skin that doesn't need a treatment. And so also research has shown that some side effects of phototherapy can be stinging or irritation on the skin and sunburn-like reaction. And then the third option is a medication in a pill form. And there are some pills one can take to not only help restore natural skin color, but also help slow down the development of new patches. One example of a pill medication is prednisone, which is a corticosteroid medication that will help slow down the development of the patches. And then the fourth treatment option is surgery. And this helps restore the skin color. And there are two types, which can be a skin graft or a cell transplantation or transplant. And so surgery is not recommended for people with active vitiligo, meaning over the last 12 months, either new patches have formed or have gotten bigger. And so a skin graft is performed by a dermatologic surgeon who will take healthy pigmented skin and transport it into the areas of patches. And then cell transplant surgery is when the dermatologic surgeon will take healthy pigmented skin and they will take the cells from that, and then they will insert those cells into the patches. And so most repigmentation from the cells will occur within 6 to 12 months. And I found that the cell transplant can be an entry, or like was the most interesting treatment option. So I did some research and I found a study on epidermal melanocyte transplantation and vitiligo. And in this study, they studied over 60 articles on several therapeutic methods for repigmentation. And the conclusion was that they found, as quoted, cultured melanocyte transplantation is the most viable, safe, and effective method in history of vitiligo treatments. This type of transplantation happens by melanocytes being isolated from normal human skin and then cultured and then transplanted to areas affected by vitiligo. Culturing melanocytes means maintaining the cells in conditions suitable for growth. So there are many different methods for culturing melanocytes. In some studies, cultured melanocytes by having them in a MCDB 153 medium, which basically it's just a mixture that helps with the growth of the cells, and then co-cultured with keratinocytes, which produce growth factors. And then another way to culture melanocytes is from cultured epithelial grafts. And then as quoted, the melanocytes were cultured on a collagen-coated membrane in MCDB 153. And so then another option, which is not a treatment, but it can help even the skin tone, is using makeup, skin dye, or self-tanner. And the fifth treatment option is depigmentation, which will remove the remaining color from the skin to create an even skin tone. This treatment is rarely used and used only on people who have lost most of their natural skin color. And this cream is applied to the areas that still have pigmentation, and it can take up to 4 years for the skin to completely even out. And some side effects of depigmentation can be burning, itching, stinging, dryness, or erythema, which is just redness of the skin, or blisters. For the research paper I analyzed, it's called Vitiligo Skin Biomarkers Associated with Favorable Therapeutic Response. And so for the study design, the study observed 6 patients with sentimental vitiligo and then 30 patients with non-sentimental vitiligo. And the patients underwent transcriptome sequencing of lesional and non-lesional skin. And then they received UVBM and tacrolimus therapy for 6 months. 11 of the patients did not receive treatment and were not included in the therapeutic response analysis. And so for the variables measured, the study measured the patients based on their target lesion achieving more than 10% repigmentation. So the patients were then separated into good and bad responses, and less than 10% repigmentation was considered a bad response. For the study findings, the researchers found that vitiligo lesions that responded to the treatment a shorter disease duration compared to the non-responsive vitiligo lesions. And there's no significant difference between age, gender, ethnicity, vitiligo subtype, or disease severity. Also, the researchers found that the immune active genes such as FcRL3 and TCR, in vitiligo lesions with short disease duration compared to long disease duration react more favorably to the therapeutic response. And for the goal of this study, it was just to find clinical parameters and gene expression biomarkers associated with vitiligo response to therapy. And so in this picture I have, it's basically just some of the parameters that they have, and it's the correlational analysis of response to the biomarkers. And for the study conclusions, in conclusion, the study identified these clinical parameters: short disease duration, panel of immune active, as well as other gene expression biomarkers that respond favorably to the immune suppressive NB-UVBM and tacrolimus therapy. So this study further just found evidence on ways to treat people with vitiligo, and it can potentially be used for therapeutic management of vitiligo patients in the future. So yeah, that was our presentation.